I'm Dr. Rob Squires. I'm Professor of Pediatrics at the Children's Hospital of Pittsburg in Pittsburgh, Pennsylvania, United States. Acute liver failure in children is rare, and the causes of liver failure vary by location. For instance, in India, most recently, the most common causes of acute liver failure are viral hepatitis A, hepatitis E, are the most common causes of liver failure in India. In the United States, the most common cause of acute liver failure is acetaminophen toxicity, various metabolic or genetic defects, medications, but many children, we don't find a reason for them to have acute liver failure. Treatment depends on the cause. There are no specific treatments for viral infections other than herpes infection, which we see more in the United States than in India. But there are no treatments for hepatitis A or B. It just has to run its course. There are children whose liver dies because of liver failure, and for that, one has to do liver transplantation to save the child's life. So liver transplantation in children has become very successful over the last 20 years. 90% of children who have a liver transplant are surviving to a year. That was unheard of 20 years ago. Now that they're surviving for a year, what we're seeing is an increasing number of patients who have some inflammation in the liver and even scarring or fibrosis despite normal liver tests and a low amount of immunosuppression. The challenge is how to manage that. You would like to minimize the amount of immunosuppression they're getting because of the long-term side effects of the medicines used for immunosuppression. But you don't want them to get into a pattern of chronic rejection, which can result in having to replace the liver transplant. So there are many questions that we have right now of the cause for inflammation and fibrosis 5 and 10 years after transplant. And hopefully this conference will allow us to share ideas to attack that problem. The future is bright because the people who are in this field are curious, and there are many challenges ahead. And so as long as people are curious about why something's happening and are eager to try to get to that answer, then the future is going to be bright. There were very talented people at this conference, not only the speakers, but in the audience, and I go away very encouraged about the future of pediatric hepatology.